into the neck once we have warmed up. And going into the neck, once we've applied our oil, we can go into some moving cupping. So you can roll their head slightly to the side so we have room. And using our small cup, we can just do some light strokes to introduce the cup. We want to make sure when we're working on the neck, if we are using cups, that we're making a line from the ear down and we're staying behind that. We can put a stationary cup anywhere on the upper trap here. So you can use a slightly larger cup and a smaller one. And then we can take them into some stretching. So supporting one hand in a nice C here is going to support at the suboccipitals. And we can gently take them into some lateral flexion. We could take them into some rotation. We could take them into lateral flexion and rotation at the same time. If you want to get a bit more stretch on the tissue, you can secure around the acromion here and gently press that shoulder down and get a nice stretch all through that lateral neck. A cup right on those upper attachment for SEM. Again, making sure your client is okay with the potential for marking here. If you're using this small cup, they might end up with a nice bullseye right behind their ear. So make sure you communicate that clearly to your client and get their consent before you do so. And we can do some nice moving cupping down from there as well. If we're going to cup in the neck, you want to make sure that you're focusing your strokes mostly downwards so that we're pushing all that blood and fluid down towards the armpit and not pulling it up into the head. Moving on to the jaw. So we want to make sure as we cup into the jaw that we are sticking right around masseters here. And because the cupping runs the risk of marking in through the cheek, especially if we're using these circular cups, you want to make sure that you get very explicit consent from your client to do so and that they are okay with the potential of having marking in this area. So once you've landmarked where you're going to be working, you can start the same as you would elsewhere. We can do some light popping cups. And we can do some moving cupping down the masseters, just down to the jawline. You can instruct your client to open their jaw as you do moving cupping as well. So we can apply the cup, instruct your client to slowly open their jaw as you drag the cup down masseters and then popping off.